These are multiple MR images which demonstrate a right-sided renal mass. Notice that the mass demonstrates a central scar, is probably slightly hypointense on the T2 weighted images, and is relatively hypoenhancing or hypovascular. Now, often when you're dealing with a renal mass, I'd say the most common entity that we diagnose is going to be a clear cell renal cell carcinoma. But most clear cell RCCs tend to be relatively hypervascular. Now, a lesion like this that is hypovascular, your best bet is usually going to be a papillary renal cell carcinoma. But in this case, there are some features that should make you consider an alternative diagnosis. First of all, the central scar, and secondly, the relative T2 hypointensity. Now, clearly, this is a surgical lesion that's going to have to come out, but these are relatively classic imaging features of a chromophobe renal cell carcinoma, a less common variant of renal cell. Now, chromophobe RCCs tend to have a very, very good prognosis. In fact, Pam Johnson and I, a couple of years ago, wrote up a large series of these lesions, and we found that most patients with chromophobe RCC had a very, very good prognosis. And imaging features that are suggestive of this diagnosis are going to include a central scar, relative T2 hypointensity, as well as relative hypoenhancement.